seismic shift in healthcare in Sioux City. Unity Point Health plans to acquire Mercy One Siouxland Medical Center and its facilities, including the hospital, physician practices, and home care services. The two have signed a letter of intent to that effect. A news release from Unity Point says the decision, quote, reflects a thoughtful commitment on the part of the respected local medical communities to enhance access to high-quality health care for residents of Sioux City and surrounding communities, end quote. In a statement, the president and CEO of Unity Point Health said, quote, we believe that local, community-led, not-for-profit health care is best for our Sioux City community and that this acquisition will help support that mission, end quote.
Mercy One CEO said in a statement, quote, we strongly believe the best way to maintain access to care in Sioux City to become sustainable long-term and to ensure a smooth transition for patients and employees is for Unity Point Health to acquire Mercy One Siouxland Medical Center. The acquisition is expected to be completed this summer, pending closing conditions. Again, the acquisition includes Mercy One Siouxland's facilities, including the hospital, physician practices, and home care services. But we don't know how many of Mercy One's 42 locations in Northwest Iowa and Southeast South Dakota, which are listed on its website, are included in this acquisition. A Unity Point Health spokesperson told KTIV more information will be provided after an agreement is signed. And we have Team 4 coverage of this developing story this evening. KTIV's Taylor Deckard and Larry Wentz are in studio with history of local hospitals and the changes in services in recent years.
We begin, though, with KTIV's Connor Trett. He's live outside Unity Point Health St. Luke's tonight with reaction to the announcement from city leadership. Connor?
Well, Matt, Jess, earlier today I spoke with members of the Sioux City City Council about that proposed acquisition, and Sioux City Mayor Bob Scott said that he and the other members of the council were made aware of that proposed acquisition of Mercy One by Unity Point Health about an hour and a half before that announcement was made. Now, Mayor Scott says that this proposed acquisition does make him hopeful for the future of healthcare in Sioux City, saying that it could bring more specialists to the area.
What they did say is they want to try to begin to get the patients that are going out of town back in Sioux City, which I think is long overdue. I'm kind of excited if it means the consolidation means that we'll get specialists back in our community that we need rather than have a lot of our citizens going to Sioux Falls and Omaha. I think it'll be a good deal.
I also spoke with City Council member Alex Waters, and I asked him if he's concerned at all about a loss of competition between the two Sioux City hospitals. Waters believes that the competition will still be there, even if it's not coming from across town.
We always have competition. I mean, gosh, you look to our north and to our south, and you have some pretty big healthcare markets. And so I think that this hopefully will encourage Unity Point to really lean into that, be innovative, be ever improving and focusing on those quality healthcare outcomes, because we always are going to be competing with those two different markets.
Now, the Sioux City Council members that I spoke with seem to have an overall positive outlook on the future of healthcare here in Sioux City, and they seem to have a they seem to be very hopeful for the future of healthcare here. Matt, Jess, back to you.
All right, KTV's Connor Trett live in Sioux City tonight. Connor, thank you.
This isn't the first time Mercy One has had major changes to their hospital. In fact, Mercy One has made major changes in just the last few years. KTIV's Taylor Deckard joins us in studio with a breakdown of those changes. Taylor?
Matt, Jessica, there have been two major changes to Mercy One services in the last decade. That includes changes to its cardiac services and its maternal care. So the most recent change happened in January of 2025. Mercy One Siouxland announced it was being shifted from a level 2 trauma center to a level 3 center, changing some of its cardiac services. Mercy One told KTIV it still offered the same level of care and most of the same procedures, but we're down to a cardiothoracic surgeon who is the point medical person for open heart surgeries. Doctors who sat down with us after this change shared that they did everything at Mercy One in the cardiac surgery process except for the actual open heart surgeries. Mercy One losing its cardiothoracic surgeon caused a ripple of layoffs, other positions described as non-direct patient care, and didn't correlate with how the cardiac lab functioned or the ICU. Another big change came 5 years ago. In September of 2020, Mercy One announced it would no longer provide maternity care for the area. Mercy One said it would no longer perform those deliveries, telling any patient over 20 weeks pregnant to go to Unity Point Health St. Luke's emergency room if they needed urgent care. Mercy One also sent patients seeking a hospital for labor and delivery care also going to Unity Point Health St. Luke's facilities. Today's announcement will likely raise many new questions about future services offered at Mercy One. KTIV will continue to push for answers. Matt, Jessica?
All right, KTIV's Taylor Deckert live in studio tonight. Taylor, thanks for that breakdown.